First of all, verapamil is an old drug. It's been around for many decades. It's called a calcium channel blocker. And what that means is that it will block the access of calcium into cells, and as a result, it changes the behavior of the cell. So in the early 1990s, verapamil was first being experimented with for the treatment of Peyronie's in men at the University of Chicago by me. And in those first studies, we found that as we increased the dose from a very low dose to now a dose of 10 milligrams, that we could safely administer this drug and hopefully stop the progression of the scar. Experimental studies on verapamil has shown that on cells which are taken from Peyronie's plaques, when exposed to verapamil, will stop making the scar-making tissues, collagen and what have you. They will also, when exposed to verapamil, stop growing, so that there is the proliferation and growth of those cells that make the scar is shut down. And then furthermore, there's some recent evidence to show that verapamil can induce remodeling of scar because of activation of enzymes which break down scars, which are called metalloproteinases or collagenases. The way the protocol works is that a patient will get an injection every 2 weeks for a total of up to 12 injections, so that would be 6 months of therapy, but typically halfway through the program, we'll stop and determine whether there's been any real progress or whether things are getting worse. At that point, we can decide to carry on with our program or cut bait and consider other options. The complications of intralesional verapamil are actually pretty infrequent. Certainly, men will get some aching occasionally in the area of the injection. They're bound to see black and blue, which tends to resolve within days to a week or so. Some men will have hypersensitivity, so if they get in the shower and the water hits the penis, they may be feeling a zinging kind of feeling, and sometimes there'll be actually a lower sensation. They feel a little numb for a while. This has always corrected itself in time. Verapamil is also a drug which has been used to control blood pressure. And part of the reason I have limited the dose that I use to 10 milligrams is because it's been well shown that when you administer that much drug intravenously, there's really no risk of having any kind of lowering of blood pressure. Verapamil has been studied and reported on in the medical literature in 9 articles. They're all more or less the same in terms of the design. Typically, verapamil is given every 2 weeks for as much as 6 months. A few studies only used it for 3 months, and they showed less benefit in terms of curvature correction, but did show fairly dramatic stabilization, because men who have Peyronie's and are identified early have a high rate, 50% chance of getting worse if they do nothing at all. So verapamil injections has a good chance to be able to at least stabilize the progression of scar. In the studies that have been published just using verapamil for, say, 6 months, 30 to 60% of those men will have measured reduction of curvature, with a mean reduction of curvature in those responders of 15 to 30 degrees. Now, the most recent study that came from my institution at Rush looked at a combination of oral therapy, injection therapy with verapamil, and daily traction therapy. And we found that 54% of those men had at least 10 degrees of curvature reduction, with a range of up to 65 degrees of curvature reduction, and the mean curvature reduction in the group that had at least 10 was 27 degrees, which I think is an actually meaningful number. Most of those men who entered that study did not need to go on to surgery. They had reduction in satisfaction with the correction that they did not need to go forward with surgery. And we had, again, no significant adverse effects. So having said that, with 2,500 men receiving up to 12 injections over the past 20 plus years, we've never had any kind of serious cardiovascular, or for that matter, any other type of serious side effect as a result of using verapamil. So I would say it's pretty safe and reasonably effective as well.